And the question is rubbing lots of people the wrong way tonight. Some Democrats think illegal immigrants, not legal, but illegal immigrants should get medical coverage on a new health care bill. Well, what do you think? Now, 22 Democrats in Congress have written a letter to Speaker Pelosi and other members of the Democratic leadership. The letter says illegal immigrants should be allowed to buy into a government-run health care plan. Why? Congressman Sheila Jackson Lee signed that letter. She joins us live. Good evening. And why should illegal people here in the United States have that ability to buy into the program, Congresswoman?
Good evening, Greta. It's a pleasure to be with you and your viewers. First of all, let me say that Speaker Nancy Pelosi has already committed to the question you posed in the last segment, is that the legislation will be on the Internet and available for American people to see at least 72 hours before members of Congress
she has, but
have a chance to vote for it.
The Senate has not, but indeed you're right. Speaker Pelosi has. It's the Senate that I'm grumbling about, and I certainly am grateful to Speaker Pelosi on that, so you're absolutely right.
And as the bill comes back from the Senate and conference, the American people will have the opportunity to see the full and final bill as well. But let me indicate to you, over the past weekend, in my city, the fourth largest city in the nation, famous personality but medical professional Dr. Oz was here holding an open clinic session. 2,000 people lined up to secure health opportunities or access to health care. The underlying premise of the health plan that is being proposed by the House and the Senate is to ensure that all Americans are required, all individuals within our boundaries are required to buy health insurance. The premise, however, is the more the merrier and the healthier the merrier, because then that will provide for resources to self-pay for all the Americans who have catastrophic illnesses and sicknesses and long-term chronic illnesses that need health insurance.
Here's what I don't understand. Let me just understand. Okay, Americans, yes, they should be able to, at least in my opinion, have part of the whatever program bill. People who are legally in the United States, people legally in the United States. People who are illegally in the United States, why are they even here? And if we can identify them for insurance purposes, maybe we can identify them to get them out of here and let them come back if they want to come back legally. But as a practical matter, if you're here illegally, either you should get the boot or you end up in jail. Or you should, you're violating the law. So why should they be part of the largesse of the American people in terms of health care insurance?
Well, I'll be happy to answer that question, since Texas has the largest number of health of individuals that are uninsured, and Texas has large cities like Houston, who likewise, Houston-Harris County has the largest number of individuals of a city that are uninsured. But the premise is that the more people in the system, the less that the system will be a burden. And the answer to your question is because illness and disease and epidemics are not a respecter of status. The idea of the premise of what I signed the letter for is to allow for those in this country that may be unstatus, undocumented, to buy insurance in the exchange that is unsubsidized. So they're using their own money. And the key is this is not something where the federal government is paying for. This is where individuals who happen to be in this country be allowed to buy the insurance.
Here's the problem. To do that, we become aiders and abettors to encourage people to be here illegally. That's the problem.
I don't think so.
If they're here illegally, they shouldn't be here. And if we can identify them in person... Okay, but I don't know. Go ahead.
Let me say this. You raise valid points, and I know these are going to be points raised by the American people. First of all of us want to ensure that criminal aliens, people who are here to do us harm, are not here in this country. But as you well know, we have another challenge before us, is to fix the broken system, as you have indicated, so that people are here who are status, and those individuals who cannot get status for some reason or another are returned back to their country. But what we're dealing with right now are millions of individuals who are working, paying taxes, and they are in this country. And frankly, if there is immigration reform, they will probably have some opportunity to earn access to legalization. But while we're doing that, Greta, we have children. Well, I don't think we can wait while 18,000 people a year are dying because they don't have any insurance.
You own the White House. You've got all three, and you've got all three.
We can't wait. we can't wait another 60 years. And frankly, there are too many people dying because they don't have insurance. And we have an H1N1 potential pandemic and epidemic. And I believe Americans are sensible enough to know that they're already paying for, in essence, uncompensated care for people who are citizens and non-citizens going to hospitals and don't have insurance. We cannot wait. And the only premise of which I signed the letter and others likewise signed the letter is the healthier individuals who can come in and buy insurance unsubsidized by any federal dollars. So really it's just allowing people to buy insurance because we ask people to buy car insurance and we don't ask for their status. I don't want to see someone driving and doesn't have car insurance.
Let me make a quick answer and then I got to go. Is number one is if something's catastrophic, we always accept them at the emergency room. We don't ask questions if someone's in a bad car accident. But what the whole point that I'm trying to make to you is that when we sort of foster illegal behavior, it's going to just create more illegal behavior.
And I don't want to do that. I absolutely agree with you. We're going to engage in a discussion on comprehensive immigration reform that answers your concern. But Greta, while we're addressing this question with the pending H1N1 epidemic or pandemic as it might be, and the idea that disease and illness is not a respecter, we've got to address this question.
And I got to go. And Congresswoman, thank you very much for joining us.
Thank you for having me.
Up next.